Before we start moving today, let me ask you a quick question. If you want to lower your blood sugar, what's the first exercise most people think about? Walking. And don't get me wrong, walking is wonderful for your health. It improves circulation, supports your heart, and helps you stay active as you get older. But here's something many people don't realize. Walking alone is often not the fastest way to lower blood sugar, especially after meals. In fact, certain simple movements that activate your muscles can help your body use sugar from the bloodstream much more efficiently. And the good news is, you don't need complicated workouts, gym equipment, or long exercise sessions to make that happen. In today's video, I'm going to show you the only 3 exercises you need to help lower blood sugar naturally. These movements are simple, safe, and perfect for people of any age. You can do them right at home, and the entire routine only takes a few minutes. Before we begin the exercises, let's quickly talk about why movement is so powerful for lowering blood sugar. Inside your body, sugar in the bloodstream, also called glucose, is used as fuel for your cells. But in order for that sugar to leave the blood and enter the cells, your body needs help from insulin and from your muscles. And this is where exercise becomes incredibly helpful. When your muscles contract during movement, they naturally start pulling glucose out of the bloodstream and using it for energy. Think of your muscles like little engines. The more they work, the more fuel they need. And that fuel comes directly from the sugar circulating in your blood. This means that when you move your body, even for just a few minutes, your muscles begin soaking up excess glucose that might otherwise stay in your bloodstream. Another amazing thing happens when you exercise. Your body becomes more sensitive to insulin, which helps glucose enter your cells more easily. This effect can last for many hours after you finish moving. That's why small bursts of activity throughout the day can make such a big difference. You don't need an hour at the gym. Sometimes just a few simple movements can help your body manage blood sugar more effectively. And the exercises I'm about to show you are designed to activate some of the largest muscles in your body, which makes them especially powerful for helping your body use glucose for energy. Before I show you the 3 exercises that can help lower blood sugar more effectively, I want to take a moment to talk about something many people already do, and that's walking. Walking is one of the best things you can do for your health. In fact, walking after meals has been shown in several studies to help reduce blood sugar spikes, improve circulation, and support your heart. If you already enjoy a daily walk, that's fantastic, and it's something I always encourage people to keep doing. But here's something many people don't realize. Certain movements that activate more muscle groups at the same time can sometimes help your body use glucose even more efficiently. Walking mainly uses the muscles in your legs. That's great, but when you combine leg movements with exercises that also engage your arms, chest, and core, your body suddenly has many more muscles working at once. And when more muscles are working, your body needs more fuel. That fuel comes from the glucose circulating in your bloodstream. So these simple movements act like a power boost for your body's ability to use sugar for energy. Think of them as a perfect complement to walking. You can still take your daily walk, but adding a few minutes of these movements can help your muscles work even harder to use up that excess glucose. And the best part is that the exercises I'm about to show you are simple, gentle on the joints, and easy to do at home. They activate some of the largest muscles in your body, which makes them especially helpful for supporting healthy blood sugar levels. So let's get ready to move together. Now, before we jump into the first exercise, and in just a moment I'll show you the movement that activates some of the largest glucose-burning muscles in your body. Let's take a minute to get prepared so you can move safely and comfortably. First, remember that you don't need to rush through these exercises. Move at a pace that feels right for your body. The goal here isn't speed. The goal is gentle, controlled movement that wakes up your muscles. If you need support, feel free to stand near a chair, a wall, or a countertop. Having something nearby to hold on to can help you feel more stable and confident, especially if balance is something you're working on. Also, remember to breathe normally. Try not to hold your breath while moving. A steady breath helps your muscles work better and keeps you feeling relaxed while you exercise. And here's something important to keep in mind as we begin. The exercises I'm about to show you are powerful not because they are difficult, but because they activate large muscle groups that naturally help your body use glucose for energy. In fact, the very first exercise we're about to do is one of the most effective movements for waking up those large muscles in your legs. When those muscles start working, your body begins pulling glucose out of the bloodstream almost immediately. So let's get ready for our first movement together. Exercise number 1, chair squats. This exercise is one of the most effective exercises for activating the large muscles in your legs. These muscles, including the quadriceps, hamstrings, and glutes, are some of the biggest muscles in your body. When they contract, they require a significant amount of energy, and that energy comes from glucose circulating in the bloodstream. This is one reason movements like squats can be very helpful for supporting healthy blood sugar levels. To perform a chair squat, start by standing in front of a sturdy chair. Position your feet about hip-width apart, with your toes pointing forward or slightly outward. Keep your chest upright and your shoulders relaxed. From this position, slowly bend your knees and push your hips backward, lowering your body toward the chair as if you were about to sit down. Your goal is to lightly touch the chair with your hips or sit briefly on the edge. Once you reach the chair, press through your heels and stand back up to the starting position. It's important to move in a slow and controlled manner. Avoid dropping quickly into the chair. Instead, focus on lowering your body with control and then standing up smoothly. If balance is a concern, placing your hands lightly on the back of another chair or extending your arms forward can help provide additional stability. Beginners can start with 8 to 10 repetitions, performed slowly. As strength improves, the number of repetitions can gradually increase. This simple movement activates large muscle groups, encourages those muscles to use glucose for energy, and helps improve lower body strength and stability. In the next exercise, you'll see a movement that works differently. Instead of focusing mainly on leg strength, it increases circulation and activates multiple muscle groups at once, which can further support your body's ability to use glucose effectively. Exercise number 2, standing march with arm swing. This movement looks simple, but it activates several muscle groups at the same time and helps increase circulation throughout the body. To perform this exercise, begin by standing upright with your feet about hip-width apart. Keep your shoulders relaxed and your chest lifted. From this position, slowly lift one knee upward as if you were marching in place. As you lift the knee, allow the opposite arm to swing forward naturally, just like it would during a normal walk. Then lower the foot back down and repeat the movement with the other leg. The motion should feel smooth and comfortable, similar to walking, but with slightly higher knee lifts and more deliberate arm movement. The goal is to keep the body moving in a steady rhythm while engaging both the upper and lower body. Maintaining good posture is important. Try to keep your back straight, your shoulders relaxed, and your gaze forward. Avoid leaning too far forward or backward during the movement. Most people can begin with 30 to 60 seconds of marching in place, depending on their comfort level. The pace does not need to be fast. A steady, controlled rhythm is more than enough to activate the muscles and encourage circulation. This exercise helps stimulate the muscles in the legs, hips, and arms while gently increasing heart rate. When multiple muscle groups are working together, the body requires more energy, and that energy is drawn from glucose in the bloodstream. In the next exercise, we'll shift our focus to the upper body, activating muscles in the chest, shoulders, and arms. These muscles also play an important role in helping your body use glucose for energy, and the movement used to engage them is simple and safe for most people to perform at home. Exercise number 3, wall push-ups. While many people think about leg exercises when it comes to blood sugar control, the muscles in your chest, shoulders, and arms can also play an important role in using glucose for energy. When these muscles contract, they also require fuel. That means they begin drawing glucose out of the bloodstream, helping your body use that sugar more efficiently. A wall push-up is a simple and safe way to activate these muscles without needing to get down on the floor. To perform this exercise, stand facing a wall. Place your hands flat against the wall at about shoulder height and shoulder width apart. Your fingers should point upward, and your arms should be straight. Next, Take a small step back so your body forms a gentle angle with the wall. Keep your feet planted firmly on the ground and your body in a straight line from head to heels. From this position, slowly bend your elbows and allow your chest to move toward the wall. Keep your elbows angled slightly downward rather than flaring them straight out to the sides. Once your chest moves closer to the wall, press through your hands and straighten your arms to return to the starting position. As with the previous exercises, the key is to move slowly and with control. Avoid rushing the movement. Controlled repetitions help activate the muscles more effectively. Most beginners can start with 8 to 12 repetitions, depending on comfort and strength. This movement activates the muscles in the chest, shoulders, and arms, adding upper body muscle activity to the routine. When these muscles work along with the lower body, more muscle groups are involved overall, which can help your body use glucose more efficiently. Now that you know the 3 movements, the next step is understanding how to turn them into a simple routine you can actually use in daily life. The good news is that you don't need a long workout session to benefit from these exercises. In fact, short bursts of movement can be very helpful for supporting healthy blood sugar levels, especially when done consistently. A simple way to structure this routine is to perform the 3 exercises one after the other. Start with chair squats, performing about 8 to 10 repetitions. Focus on slow, controlled movement and good posture. Next, move to standing marches with arm swings. Continue marching in place for about 30 to 60 seconds, maintaining a steady and comfortable rhythm. Then perform wall push-ups, completing about 8 to 12 repetitions at a controlled pace. Once you've completed all 3 exercises, you have finished one round of the routine. Most people can aim to complete 2 to 3 rounds, depending on their comfort level and fitness level. If you're just starting out, even one round can still be beneficial. These movements can be done at different times during the day, but the most effective time to perform them is after meals. After you eat, your blood sugar naturally rises as your body begins digesting carbohydrates. This is exactly the moment when your muscles can be most helpful. When you perform simple movements like the exercises we just discussed, your muscles immediately begin using glucose for energy. Because of this, doing these exercises shortly after a meal allows your muscles to pull more glucose out of the bloodstream, helping your body handle that rise in blood sugar more efficiently. For many people, performing a few minutes of movement within about 30 minutes after eating can provide the greatest benefit. So if your goal is to support healthy blood sugar levels, the most powerful strategy is simple. Eat your meal, then move your muscles. Even a short routine like this can encourage your body to use that's circulating glucose as fuel instead of letting it remain elevated in the bloodstream. And there is one more simple habit that can make these exercises even more effective, something many people overlook. Let's talk about that next. It involves something very simple that you may already have in your kitchen. I'm talking about apple cider vinegar. Research published in the Journal of Diabetes Care has shown that consuming apple cider vinegar with meals can reduce the rise in blood sugar after eating and improve insulin sensitivity. One of the reasons this happens is that apple cider vinegar helps slow the digestion and absorption of carbohydrates, which means glucose enters the bloodstream more gradually. Because of this effect, adding apple cider vinegar to your routine can help your body manage blood sugar more effectively, especially when it is combined with movement like the exercises we discussed earlier. A simple way to use it is to mix 1 tablespoon of apple cider vinegar in a glass of water and drink it shortly before or with a meal. When this habit is combined with muscle-activating exercises, your body has 2 powerful strategies working together. One helping control how quickly glucose enters the bloodstream, and the other helping your muscles use that glucose for energy. One important thing to remember is that apple cider vinegar should always be diluted in water, because drinking it straight can irritate the throat and affect tooth enamel. As you've seen, managing blood sugar doesn't require complicated workouts. Simple movements that activate your muscles can make a meaningful difference. The 3 exercises we discussed, chair squats, standing marches with arm swings, and wall push-ups, engage major muscle groups that help your body use glucose for energy. When you combine these exercises with smart habits like moving after meals and using diluted apple cider vinegar, you give your body multiple ways to support healthier blood sugar levels. The key is consistency. Even a few minutes of movement done regularly can help your body manage glucose more effectively over time. If you found this video helpful, consider sharing it with someone who might benefit, and subscribe for more practical health tips.